Eliascan Corlia, agus ní doubt bí na ghúil an ggéircimtííachta galanálcas loine loe, agus tá ní smó daoine áganis ag marachta sa bhála lena dúsmarí nadal imirce thsile, agus tá chip omlan tháineise ar do phlean hííachta agus phlean an rialtas, agus ní féidir lecha airú rialtas dóthas a thuirt a ghaoine go dtí jeú leis an ggéircimtííachta. Eliascan Corlia, the housing crisis is worsening every day that this government is in office. More and more young people are being forced to live at home with their parents, well into their 30s now, or to take the choice to immigrate. More and more people, working people, as they get closer to retirement, are being locked into insecure and overpriced rental market, and they're fearful for their future. We've had contact from one of these persons who has a good job at a Dublin hospital. The person's in their 30s, a good salary, but she can't find a single place to live that is somewhat even reasonable. Most of the apartments in the area are nearly €2,000 a month, and that doesn't include the bills. And this person tells us that they are completely hopeless. She says that the situation they and so many of her generation face has been created by successive governments, allowing the few to profit off her generation and lock them out of any sense of stability. And I completely agree with her, because your government is failing, and is failing to deliver the genuine affordable homes that working people need. It's widely acknowledged now, Taoiseach, widely acknowledged that your housing targets are far too low, wholly inadequate to meet the need of the actual demand of housing right across the state. And yet, despite all of this, your government refused to increase housing investment above these inadequate targets in the recent budget. And each year, you fail to even reach those targets. You keep telling us that you have the most comprehensive housing plan in the history of the state. You keep telling us that you're spending more and more money on social and affordable homes than ever before. But yet, when you look deep into the facts, the reality is very different. This year, €4 billion was to be spent to deliver 14,500 social and genuinely affordable homes. But today we learn, at the end of September, less than half of this allocation has been spent. So what does this mean? It means that thousands of affordable homes for working people that your government promised will not be delivered this year, just like last year and the year before and the year before. In fact, figures from the Minister for Housing show just how bad that your government is doing. By June of this year, only 15% of the social homes that were promised had been delivered, and only 123 out of the 4,400 affordable homes that were promised had been delivered. 123 affordable homes, Taoiseach, and not a single affordable home delivered by the Land Development Agency. So, Taoiseach, if you want to figure out why house prices and rents are rising, then this is the reason. This is why house prices and rents are rising. This is why homelessness is rising. This is why people feel hopeless, like that woman who works in a Dublin hospital who can't find anywhere to live. This is why your plan is failing. The housing targets need to be increased. It needs to start with the delivery of 21,000 social and genuinely affordable homes next year. The expenditure ceilings for housing delivery need to be increased, and the red tape needs to be cut to ensure local authorities and approved housing bodies can deliver homes at pace and at scale. The response from government needs to meet the scale of the emergency that is right across the state. So will you finally accept, Taoiseach, that your plan is failing? It is failing that worker in the Dublin hospital. It is failing the people who are in Dublin airport at this minute. It is failing the people who are in emergency accommodation. It is failing those who are locked out of home ownership and those who are locked into extortionate rents. Will you finally acknowledge that it's failing and churn course?
Ní an tíim leis an tugtadála agus ní an áras inis go bhfuil a bhfad níos mó tithe á thógáil againn agus ag an rialtas seo na aine eile agus tá plean a bhfad níos cuimseacha againn ná tá go tain. Ní léon phlean agat agus cé go mbíonn tú ag bécaigh i gcónaí níl mórán taobhhiarda. Ní léon phlean cuimseach aguise. Fact. Agus tá sé ag gcuine scéim inig scéime ina bhfuil ag tóir tacaíocht don téasóg the linga show. I would say to you, Deputy, that you're wrong, and no shouting and roaring is going to change the fact that this government has significantly turned the dial in relation to house construction. In terms of over 30,000 houses constructed last year, and we will exceed targets again this year, and commencements, as in the newspapers this morning, up 14% on last year, and completions up 14% on last year's. And Sinn Féin don't have a comprehensive housing plan. You have nothing but a collection of sound bites and a few pages. You haven't put in the hard work. And when it comes to young people in this country, look at Sinn Féin policies. You don't do anything for first-time buyers. Your policies are anti-first-time buyers. You would get rid of the Help to Buy scheme. 42,000 young buyers benefited from the Help to Buy scheme. You oppose the First Home scheme, which allows 30% state equity in houses for younger people to buy those houses. 2,500 have benefited this year. If you had your way, they would not be able to avail of that particular scheme. And the grants we've made available in terms of vacant houses or houses that are derelict, 50,000 and 70,000 respectively. You've opposed that as well and voted against it. And as you add to that, you opposed the Land Development Agency. You have a long history of opposing, and on the ground you're probably one of the more serial objectors to housing that we've witnessed over the last 5 years. So, Deputy, it's about time that Sinn Féin came forward with substance and not empty rhetoric and soundbites. The fact of the matter is the government does have the most comprehensive housing plan, and I have said that before, and I don't see that comprehensive plan in anything that you have produced, in any policy document that you've produced in respect of that. And also, if you look at, for example, on social housing, over 10,000 social homes delivered last year in 2022, which is the highest level of social housing delivery in decades. And this year we aim to deliver nearly 12,000 social homes, including 9,100 new build homes. And there's a strong pipeline of over 22,000 social homes, either on-site or at design and tender stage. And in 2024, we have funding in place to deliver over 11,600 social homes, including 9,300 new builds. And since 2020, 30,000 new social homes have been added to the social housing stock, including 19,000 new builds. There are now approximately 2,500 tenant in situ purchases progressing at various stages. And in respect of the cost rental, for example, there's been a dramatic provision there and affordability. So, to be fair to the Minister for Housing, he has come forward with a variety of programmes and investment that I think outrivals anything you've produced, Deputy. And you don't have substance in your policies. And you've been anti the young first-time buyer. And you've covered it up. There's a camouflage over it. But if you go through the detail of how you've performed in this House over the last 3 years when various pieces of housing legislation came before, you opposed anything that would help young first-time buyers. And we now have more first-time buyers drawing down mortgages this year and last year than we've had for many a day.
Well, you know, the government's response to any of the crises that we point out to the government is but Sinn Féin. That's the sum up to you. Yeah. That we've stopped all of this, that we're the fault for a housing crisis, despite the fact that your partners in government have been in government for 12 years and that you have supported your government for 7 years.
Not in government 12 years.
Your partners in government have been in government for 12 years and you've supported government for the last 7 years. And the reality is, and you can have your head so far in the sand as you want, but there are nearly 13,000 people in emergency accommodation. There is a whole entire generation. You talk about home ownership. People have lost hope that they will be getting onto the property ladder because of the policies of your government that are pushing up house prices, and we still see that even with CSO figures recently. That's the reality of it. Why are people deciding to emigrate? They will tell you that they feel that they cannot own a home here. Home ownership is reducing under your government. We have people who are well paid in the sector who can't get homes. People who work in our professional services can't get homes in Dublin under your government. So rents are up, homelessness is up, house prices are up, but somehow it's always Sinn Féin's fault. The dogs in the street know that the targets that you have set are far too low. But worse still, your minister, just in case you don't know this, has missed their targets on social and affordable housing every single year for the last 4 years. That's the reality.
No, you're wrong, Deputy. You're wrong.
Explain to me how I'm wrong.
And here you go again.
Explain to me. Did he meet the targets? targets on social and affordable
Through the
housing.
Chair, if I may say so.
Taoiseach, before we start, before we start, can we have a little respect, please? Okay? You have 1 minute.
I'm interested to hear how you met the targets on social affordable. This will be very exciting.
Shouting is not a policy, and shouting and roaring doesn't deal with the substance of provision. I've always said housing is the biggest social issue facing this country. That's why Fianna Fáil took up the portfolio at the beginning of this government. We didn't take on an easy task here.
You've
we
been
knew
worse.
the challenge.
Let the Taoiseach.
But the important point is, we have produced the most comprehensive plan, but it's not, and we're implementing it. You haven't, Deputy. And I want to make the point to you, 400 first-time buyers each week are now buying their first home. Listening to you, one would imagine nobody was. 25,000 first-time buyers through the Chair drew down mortgages in 2022. That's the highest number since 2008. And 41,007 homes were purchased between January and August of this year. That's 27% of those, and then 27% of those by first-time buyers. So we've developed schemes that are helping first-time buyers.
Explain to me how I'm wrong that the Minister missed his targets.
To you, Deputy, that your policies and your approach.
You want me to whisper it to you? Explain to me how I'm wrong.
Negative, and have opposed measures that would improve the situation for first-time buyers. You have been anti-first-time buyer initiative.
And it's all Sinn Féin's fault. You have missed every single target, and your government's making things worse. Time to get your head out of the sand.
Deputy, please, can we do this through the Chair? Okay. Thank you. Comajik Bugger Ryan Ishwiji and Chuck the Holly Cairns.
Taoiseach, as I'm sure you're aware, the government is running an ad campaign at the moment on the UN Convention on the Rights of People with Disabilities.
Please.
Taoiseach, as I'm sure you're aware, the government is running an ad campaign at the moment on the UN Convention on the Rights of People with Disabilities. It's as if the government suddenly wanted to make people aware that disability rights are human rights. Taoiseach, can you understand how disabled people or parents of children with additional needs who are currently waiting years for basic, bare minimum services would think that the ad campaign is some kind of a sick joke? Surely you can see the hypocrisy when the state is the reason why people can't exercise these human rights. Taoiseach, I shouldn't have to remind you that disability services in this country are shameful. Rights are entirely notional. They're on paper and they're in the UN CRPD, but not an option in practice in our communities. Nobody gets anything they're entitled to without a fight. Parents of children with additional needs spend their whole lives fighting. They're in a constant battle with a system that's supposed to support them. The only thing their children are guaranteed is waiting lists. Sometimes those waiting lists last for years. Taoiseach, 16,522 children are currently waiting for their first appointment with the Children's Disability Network team. More than 10,000 of them have been waiting for over a year with no intervention and no therapy. These delays are so bad because of chronic staff shortages. More than a third of posts in Children's Disability Network teams are vacant. In some teams, vacancy rates are more than 60%. This wholesale and pervasive state neglect has disastrous and lifelong consequences. Children have a very small and critical window to get essential early intervention therapies. If they don't, their development can be limited and they can be prevented from reaching their full potential and living a full independent life. These children are not just being failed by the state, they're being actively harmed by persistent neglect. If people had a right, as the government is now advertising, they'd be able to take a case when they can't exercise their right. But they can't, Taoiseach. Why? Because your government and previous governments haven't ratified the optional protocol of the UN Convention. And then the government runs an ad campaign to tell people that they have rights that they can't exercise. Taoiseach, 3 years into this government, Ministers O'Gorman and Rabbitte just published a new roadmap for disability services this week. Among other things, the plan says it will fill 460 vacancies by the end of 2024 and 240 by the end of 2025. Doing that would be an improvement, but how are you going to do that, Taoiseach? The plan says it will fill vacancies with a robust recruitment and retention plan, but what specifically will you be doing differently to hire staff? I searched the roadmap as well for a budget, but couldn't see it. How much additional or new funding has been assigned to rolling it out?
Thank you, Deputy.
And finally, given that you're advertising people's rights under the UN Convention, will you ratify the optional protocol?
First of all, I think I would acknowledge that there are very significant challenges facing families with children with disabilities, particularly in the access to therapies. But I think there has to be a balanced perspective in terms of the overall disability provision. I would argue that over the last 3 years there's been very significant progress, and in years before that, on special education, which you didn't refer to in your commentary. And while that is always challenging, I think it has been a key priority, and delivery there has been more effective than in the health service in terms of therapies and in the CNDT teams. On the budget 2024, we're now looking at about 2.7 billion allocated to provide additional teaching, care supports for children with special education needs. That's a 5% increase in last year's funding. There'll be an additional 744 special education teachers, over 1,200 additional SNA posts. We now have 20,000, over 20,000 special education teachers supporting students across the school system, and we have 21,584. I can recall when I was Minister of Education, when I initiated the SNA scheme, we had none. So I think we do have to look at things and say, we have a lot more to do, but over the decades, a lot happened in education, in the integration of disabilities into education. And then in terms of the recent budget, we increased the domiciliary care allowance in terms of the once-off funding, and we did the same last year. So we've increased funding in terms of the various disability payments on the social protection side. On the health side, and now disability has moved over to the Department of Children, there is significant funding there to assist in terms of expanding services. The one area which has proven very, very challenging and difficult is access to therapies. And the model was adopted by the HSE over a decade ago, which has not, and it was entitled Progressing Disability, which has not yielded results, or the results that we require. In some areas it has, but in respect of recruitment and retention of physios, OTs, and speech and language therapists to that service. We have had many engagements with the HSE, and we're continuing. I know the Minister for Disability, Anne Rabbitte, is continuing that engagement with the HSE in respect of recruitment and retention of therapists. Other parts of the health service has been far more effective in recruiting therapists than the paediatric side or the special needs children side of the system, and that is an issue, and I think there has to be, and there is renewed focus on how we both recruit and retain therapists so that children can have ready access to them.
You said we need to have balance with respect to the overall approach to disability services, and you flagged education. It's important to note that we're still in a situation whereby there's no kind of assessment done of how many children are at primary level that will need a particular type of class or school going into second level, and then people can't get any access to education. Some people are travelling 2 hours to get to a special school. So flagging education is something where there's been overall improvement, I think, goes to show how pitiful the overall picture is. And just to highlight, again, the overall picture, in this budget, you allocated 64 million to disability services. I thought that was a typo in the budget, because the department's own capacity review said we need another 350 million to meet the unmet need of disabled people. You've only ever introduced a one-off disability payment, not acknowledging the fact that disabilities happen, or people have a disability every day of the year, not for one day in the year. Then, if you look at the overall picture, there's things like the motorised transport grant. That was axed 10 years ago, a decade ago, and the government haven't introduced a new one. And there's the kind of the saying, show me your budget and I'll tell you your priorities. Your government is not prioritising disability services. If there wasn't an allocation to make real improvement in this budget with such a huge surplus, it's difficult to believe that this government ever would do it. But back to my questions, which you haven't answered. Will you ratify the optional protocol? How do you plan to recruit and retain staff in Children's Disability Network teams now that you've released this new programme, this new plan? Because we've heard time and time again in the Disability Matters Committee that the problem is recruitment and retention, that you're putting millions into trying to recruit and retain staff. It simply isn't working. Then we have a situation where finally Section 39 workers get an attempt at a kind of pitiful attempt at pay parity, but it's only a 10% increase. So we still have a situation where staff and CDNTs don't have pay parity, will continue to leave and go into HSE jobs. So how are you going to staff the Children's Disability Network teams?
I'm afraid you benefited from the clock.
Thank you.
Yeah.
It's not a pitiful. There's an 8% increase in pay agreed through.
Without pay parity, people will still
sorry,
leave and go into the HSE.
You had your
chairs.
chance.
Through the chair.
And the investment in education is not pitiful either. It's been very significant over the years, and significant advances have been made, particularly at primary level. And yes, there needs to be, in terms of progressing into second level, but we have provided stronger legislative obligations on schools, all schools, to take children with special needs in at second level. To me, and by the way, the core rate went up €12, not a once-off. The core has gone up €30, with probably €29 since the government came into office in terms of core welfare rates, in terms of disability payment, and then the domiciliary has gone up much higher in terms of the core rate of domiciliary care, which is the way it should be. And the most, and you've said this yourself, recruitment of therapists was not a funding issue, and hasn't been a funding issue for the last number of years. It's been a recruitment issue and a retention issue, and yes, a work culture issue, seems to me. When I say, I mean, within the employment space that the HSE are providing for therapists with children needs to be improved.
Michael Lowry.
Taoiseach, for years it is widely acknowledged that there are fundamental problems and administrative problems with the HSE. Successive governments have tried and failed to rectify core issues with the delivery of healthcare. Newly ordained senior executives arrived with great ambition and left disheartened. Some of those key executives are now sideline commentators who seem to know it all at present, but have little progress to show for their time in authority. Ministers have been scapegoated in the past, and no doubt Minister Donnelly will shortly be threatened with the sword. I believe in ministerial and governmental responsibility. Taoiseach, you and your government colleagues have a duty of care to countless men, women and children who suffer daily because of a totally inadequate service. Clarity must be brought to the financial and budgetary situation of the HSE. Uncertainty is creating widespread fear and trepidation to those who work within the service and the countless people across Tipperary and the country who rely on the HSE for life-saving interventions. Also, the many inflicted with illness who require ongoing support to sustain a reasonable quality of life. Planned changes by CEO Bernard Gloucester to establish 6 health regions across the country are being viewed as a positive move. This plan sounds reminiscent of the former Health Board era, when obtaining healthcare was easier and far less traumatic for people, a time when people did not languish on hospital trolleys for hours or even days, or find themselves on waiting lists for months or even years. A more localised management structure would be better equipped to serve the needs of each region and would be easier and more efficient to navigate. Regional management of health provision is one of the key reforms contained in Sláintecare. Urgent and effective change is crucial. The island of today is a very different place. Our population has exploded. Demands for all levels of healthcare have multiplied. Standards in medicine and diagnostics have advanced enormously. People are more knowledgeable and diligent about their health requirement. Each of these factors have increased pressure on an already dysfunctional system. The CEO has stridently stated that the health allocation for the coming year is insufficient to meet needs. It is already apparent that a supplementary budget of €1.5 million would be required to bridge the gap. This has become an established, alarming budgetary pattern. There is major and understandable concern that throwing money into the existing bottomless pit that the health service is difficult. It is not addressing the problem, it is simply bridging the gap year after year. Bridging that gap will become insurmountable, and our health service will eventually eat into funding required for other crucial sectors of our economy. It is difficult for government in the future to justify reduced spending on housing, infrastructure, education or business in order to cater for health. Yet year after year, this scenario seems more and more inevitable.
Thank you, Deputy Lowry. Taoiseach, please.
I thank the Deputy for the question and the issues that he has raised. And I think this year's overall health budget is about 22.5 billion, and that's allowing for the 2 billion that has been removed and crossed over to disability department and Department of Children and Equality. It's the highest allocation ever for health. Over the last, since this government came into office, 2020, in June 2020, there's been increased budget allocations of about 7.4 billion. Now, it's important to point, and that's since 2019, that's excluding the funding for disability. So 7.4 billion. But I think it is important to point out that there has been a lot of increased activity as a result of that spending, and people have benefited a lot from that spending. So we've removed inpatient hospital charges, for example. We had the biggest expansion of access to free GP care in the history of the state. We've added to 500,000 more people. So 60% of our population now hold a GP card or a medical card. We've reduced the drug payment scheme costs. Diagnostic scans for patients have been funded. Free contraception up to the age of 31 has been introduced. For the first time ever, we're publicly funding assisted human reproduction. There's a new consultant contract with up to 700 consultants having already signed up. There's been a reduction on waiting times and waiting lists after the build-up during COVID-19. The community health service has expanded, an entire new programme, particularly in chronic disease management and in primary care, older persons and ambulance services. And that community care piece is very important because it always got hit by ongoing increased expenditure on the acute side. 22,000 staff have been added since 2020, and about 1,000 extra beds have been put in, and significantly also in ICU. That said, and it's worth pointing out that if you look over the 20-year period, life expectancy, we've one of the highest life expectancies in the European Union. And that's positive, and it's not disconnected to significant increases in health expenditure, and the way we live our lives has changed as well. And I want to welcome all the young people and children who are here visiting us. So lifestyle matters, and eating good diet matters, seriously, and healthy behaviour matters in terms of lifespan. It does. And we've dramatically changed our cancer outcomes, we've changed our heart disease outcomes, our stroke outcomes have dramatically improved, and that has led to better longevity. Now, your point, though, it is valid then that there would be an evaluation of the funding and the amount of money that goes into health to get more efficient in terms of the spending of that money. And the Minister has commissioned a detailed study on future costs of healthcare, but also value for money efficiencies, looking at things like the drug budget, for example, of 3.3 billion, and he will bring in independent experts to analyse that. I'll come back to you on regionalisation at the end.
Deputy Lowry, please.
Could I also raise with you, the greatest issue facing our health service is actually the retention of staff. And this is partly due to younger people choosing to emigrate as they find it difficult to purchase or afford a place to live in Ireland. Also because our more mature and highly experienced staff are quitting their jobs prematurely. Their love for their work has not changed, but the conditions that they work under are intolerable. The mental and physical pressure that they endure is unending and unsustainable. After COVID, the country came to a standstill to applaud our nurses and healthcare staff for their extraordinary work during the pandemic. But we need to remember that their work every day is no less extraordinary. The work of our health teams is highly pressurised and unrelenting, work that is physically and emotionally exhausting. And if we don't lighten the burden, if we don't increase the staffing numbers, if we don't increase the resources, these jobs will become untenable for many people.
Thank you, Deputy Lowry. Taoiseach.
I think you are correct in saying that recruitment and retention has been a very significant issue, notwithstanding the fact that we've recruited 22,000 in 3 years. But in home care, for example, where 53,000 people receive home care every day now, and there's been huge improvements and expansion. Eventually, we were expanding so much in home care that recruitment became an issue towards the latter part of that expansion. I think the work environment could, and the whole human resource practice within the HSE needs to improve, in my view, and needs to focus more on retention and the work environment for high-quality people who are working in our health services, because it is very stressful. It's never-ending, and particularly if you consider in the acute side, most people who go into hospitals today they need to go into hospital. It's more acute. The level of acuity is much more increased, and that means greater stress and burden on those who are working within the service. It's 24/7 in terms of seriously ill people coming into hospital, requiring, particularly in our acute tertiary hospitals, requiring the attention of our teams of staff. And I would acknowledge the point you've made in respect of really working hard and making the work environment better for those who work in our health service.
Thank you very much. And our fourth question comes from the Rural Independent Group, and Deputy Carol Nolan, please.
Taoiseach, I'm sure you will agree with me that those who have unfortunately received a cancer diagnosis do not have the luxury of time while multi-annual budgets are introduced or while efficiencies are found in the health spending. This is true at the medical end of the spectrum also, and it is true with respect to the excellent community support organisations that often accompany cancer patients and their families through what is often one of the most stressful and difficult times in a person's life. And that is why today I want to highlight the challenges that are being experienced by a fantastic Offaly-based service, DOCUS, Offaly Cancer Support Group. Representatives from DOCUS met with Minister Donnelly along with other members of a working group on the 13th of September of this year, and they impressed on him the seriousness of the funding situation facing the wider collective community of cancer support services. The Department of Health did undertake to speak with the National Cancer Control Programme and also the CHOs to see what funding may be available through them, as well as exploring any other avenues for possible once-off funding. DOCUS also submitted a comprehensive business proposal to Ms Carol Broadbank, Chief Officer of CHO 8, outlining the need for Section 39 funding at local level. But what did DOCUS get for all their trouble? A one-line response with an apology that no funding would be made available for DOCUS, despite the fact that DOCUS Offaly Cancer Support Group falls into the same community healthcare organisation as Larkin Mullingar and the Cushla Centre in Portlaoise, both of whom are receiving Section 39 funding through CHO 8. And indeed, these organisations also do fantastic work. But I want to stress that DOCUS has an excellent and collaborative working relationship with these centres that I've just mentioned, as I say, who do excellent work, and it's good that they've funding. But the fact here remains that there is a gross disparity in funding that needs to be addressed. The major concern in DOCUS is that it is not receiving any funding through CHO Area 8, despite the other two groups receiving it. DOCUS and the community throughout Offaly that relies on it for vital support is now at risk of what is looking like a major operating deficit for 2023. And I think that what we're talking about here, my understanding is that it's approximately €50,000. In real terms, it may mean the difference of DOCUS being able to operate a vital service or not being able to operate a vital service. Taoiseach, I'm calling you to take whatever action is necessary to revise this decision and to have the HSE extend the courtesy of providing something more than a one-line reply to cancer advocates like DOCUS.
Thank you, Deputy.
Well, first of all, I actually have addressed this issue before the budget. I spoke to the Minister of Health in relation to community cancer support groups across the country who came together to seek additional supports for organisations that were established as voluntary organisations, and they're, as we all know, significant fundraising efforts in various communities across the country have underpinned these cancer support groups who provide very valuable services to cancer patients and their families more specifically, and they provide tailor-made psychological, social, community supports to children, to young people and to parents. and siblings and so forth, and it's very, very valuable. Now, it has never been in the Section 39 space. Most of these organisations haven't been, if we're honest, and I think the idea that we'd be moving to Section 39 overnight, I don't think was a realistic proposition. But what they did ask was that we would begin a funding stream for such organisations. Now, the Minister has allocated 3 million actually. I think it was 2.75, but I think that will go up to 3 million for such organisations. And then the hope would be, there's been an assessment made. I think the ask was higher, but one has to work through the capacity to absorb and so on like that. And then the hope through the National Cancer Control Programme, which has now in its latest strategy has allowed for the importance of this in its strategy, that in the future then we mainstream that as a recurrent funding. So I don't know when DOCUS got the letter, but I would like to think that we would review that in the context of the allocation in the budget. I'll talk to the Minister for Health in relation to it. But I believe these are very valuable, and the problem very often is the acute services absorb all of the money in health, not all of it, but a lot of it, and sometimes to the detriment of the development of other strands of healthcare. And the work that these groups do is invaluable in supporting, once people leave hospital or come away with a diagnosis of cancer. It can be a very anxious moment, a very worrying moment. They come out of hospital, they've just got news. These are really very important, almost lifesavers for people to have opportunities to meet with others who have been similarly diagnosed, and that they can meet and discuss the implications of it for them and their families. So this is a start, Deputy. I think you've raised an important issue. I'm very interested in it myself. I've worked with these organisations for quite a long time. They came to us to make a submission, and we've made a response. It may not be at the scale that people might have wished, but I think it's a very significant start and intervention.
Taoiseach, thank you for your response, and also I want to acknowledge the fact that you have said that you would be favourable to asking the Minister for a review. I think that's absolutely crucial here, because there's so much frustration in terms of the inequity of the funding that two other groups in the same CHO Area 8, which is welcome, were able to qualify for Section 39 funding. And yet this group, and I want to say that DOCUS and their staff, they do incredible work. That's without a doubt. And they're badly needed in the area, you know, and in the county and beyond. They do fantastic work and they need support. And it's my understanding that it's only a small sum really in the grand scale of things that's needed here in order to keep this service operating. So it is vital. It is obviously disappointing to see also that DOCUS invited representatives from the HSE down to the centre to see firsthand the invaluable work they do, and that this invitation was never accepted by the HSE representatives. That's disappointing. And I know obviously it's nothing to do with you as Taoiseach, but it is important to say that here today, that's what's happened.
Thank you, Deputy.
But I just want to ask as well, like, how can the HSE come in here looking for billions of funding when they're not going to support organisations like DOCUS in our communities?
Thank you,
I just think it's a bit much.
Well, to be fair to the HSE, they have enormous challenges in budgets as well, but I think but they should be working with these organisations. I know with the ARC Centre, it's the consultant, Professor Seamus O'Reilly in our city, has been leading the charge for these centres. As a consultant and a clinician, he sees the value of organisations like ARC in that context, and advocates very strongly. And by the way, the 3 million has to be additional to whatever existing funding CHOs in different parts of the country are allocating to these organisations. We don't want it to replace existing local arrangements and provision that the HSE, to be fair, in certain CHOs have provided funding to quite a number of organisations. I'll ask the Minister to look at the DOCUS situation in the light of you raising it here in the Dáil.
Tánaiste Rockmid Reigenis, the and Kate piece, Ganoela,